Hi everyone, welcome back to another episode of Be a Nurse They Said. My name is Lainey and I'm so happy that you're here. If you have not gotten the chance to yet, make sure you hit that subscribe button so you can stay up to date on all things on my channel and see all my videos and shorts that I post. This week we're going to talk about tips and advice for the new nursing student. So this is the new nursing student just starting out in wherever program they're at, taking their first nursing classes or their general education courses, and just some tips and advice to help get through that. Nursing school is very stressful. It's a lot of hard work. It can be very difficult and it is extremely time consuming, but it is absolutely worth it in the end. So I want you all to be successful. My first tip is to learn the must-knows early. A lot of you are probably in your anatomy and physiology classes, your pathophysiology classes, and these are two very important classes that you cannot just learn all of the information and then dump it all away when you're done with it. Anatomy and physiology and pathophysiology are going to follow you through your entire nursing school journey and through your entire nursing career. You're going to need to know how the body works. You're going to need to know how those different disease processes interact with each other. So it's very important to take these classes seriously and don't just brain dump all that knowledge that you learn in them because you are going to need it. Another thing that's probably important to know is abbreviations. There are a lot of different medical abbreviations that you're going to see throughout your nursing career and even during nursing school that you should probably be aware of. Also, normal lab values. You will learn these in your anatomy and physiology class. They will come back in nursing courses once you are in them. We like our students to be aware of normal lab values so they know when what's out of range, what's in range, what to look for when they're out of range, the signs and symptoms for those different types of things. My second tip is to not just memorize. Actually try and take time to learn this information and understand the information, not just learn things for the exams and then you just forget it after you're done. Just like when I talked about with the A&P and the pathophysiology classes, you're still going to need to know that information. So please try and actually learn the information and understand the information, not just memorize. My third tip is to practice NCLEX style questions. While you're in your general education courses, you're most likely not going to see these NCLEX style questions. However, it's great to start training your brain now. That way, once you get to your nursing courses, you understand what those questions look like and you're not thrown for a total loop. Nursing questions are extremely different than any other type of question. It's basically asking you which orange is the most orange. You have to pick the most right answer. Even if all of them could be correct, which one is the most correct? So to start doing those NCLEX style questions early is great to help you learn those style of questions. I do have some shorts on my page with some practice NCLEX style questions, so go ahead and check those out. You can see kind of what I'm talking about. My fourth tip is to stay organized. Organization is key. If your notes are all over the place, you don't understand what's happening, it's a really good idea to sit down and really organize yourself. Color code if that's your thing. This is for this class or this is for this topic. This includes keeping an agenda of due dates, of exams, when those are, to really keep yourself on track and to keep yourself accountable. Be early, be prepared, and be present for class. When you show up right on time or you show up late, it kind of throws off your whole day. So be there early and ready to go once class starts. Be prepared. If there's any sort of pre-class assignments, please be doing them. They're assigned for a reason. They're to help your learning. And if you go in prepared for class, you're more likely going to understand the information more than if you did not prepare for class. You don't want to be confused while lecture is happening. Also, being present for class, be engaged. If your professor is asking questions, raise your hand and answer them if you know the answer. Being engaged and being present is super important because it's only going to help your learning. My next tip is to ask questions for clarification. This goes along with being prepared and present in class. You can ask those questions if you're confused about a certain topic. If you're not one who wants to raise your hand during class, you can always wait until after class is over to ask your professor those questions, but please do be asking them those questions. If you're confused about something, you need to seek clarification because if you don't get that clarification, you're going to continue to be confused, and then the more information you learn, the more confused you're going to get. So make sure you keep a list of your questions and get those answered. Next, I want you to find your people. Nursing school is basically like trauma bonding with other people. They're in the same situation with you, they're going through the same thing, and you can really help each other and support each other to get through this time in your life. It's also good to use these people as study buddies. If you study better by yourself, then that's fine too. But if you have a group of people who are studying the same things as you, sometimes I might know something that you don't know, or you might know something that I don't know, and you can explain that content to me. It might not be as scary for some people than going to the professor for problems. If you have a fellow classmate who's able to help you understand that information, that can be just as beneficial. My next piece of advice is to not compare yourself to others. So even if you find those people that are your people in nursing school, please try not to compare yourself to them. Everybody is different. Everybody learns in a different way. Everybody learns at a different pace. You can't compare yourself to someone who read something in the book one time and understands it if you learn a different way other than reading. If you're more hands-on, if you're more auditory and you need to listen to an audiobook to understand something. You just can't compare your learning to others because everybody is different. What's important here is to find your strengths. So like I said before, if you know something that I don't, or I know something that you don't, you can each use your individual strengths to help each other learn and get better. My next piece of advice is to take breaks. And I mean this as when you're studying. Take breaks. Definitely devote time to study, schedule specific time to study in your calendar. But while you're studying, look at stuff for 45 minutes and then take 5 minutes to go get a snack, take a stretch break, go to the bathroom, whatever you need to do, then come back and study some more. If you try and sit there for 4 hours straight and study, after so long, your brain's not going to absorb any information and you're going to have to reread or relearn things that you thought you were reading in the first place. And it's just going to take up more of your time and be less beneficial for you. So take breaks when you're studying. My last piece of advice is to remember your why. Everybody has a different reason for being in nursing school. Everyone's journey is different. You just have to remember why you are there. You can't focus on anybody else. Just like I said, don't compare yourself to others. You can't focus on their reason or hers or his. You have to focus on yourself. Why are you there? Who are you doing this for? What is your goal at the end of this journey? As I stated before, nursing school is not easy, but it is absolutely achievable. You can do this. Just use these tips to help guide you through this first year of nursing. It can be very intimidating. It can be very scary, but like I said, it is doable, it's achievable, and you can do this. Whether it's a 2, 3, or 4-year program, each program is going to require your time, your energy, and your dedication to get to where you need to be. You just have to believe in you because you're the only one that can do this. Your instructor can't do it for you. Your friend can't do it for you. Only you can do it for yourself. I want to thank you all for watching this video. I hope these tips were super helpful for you. Please, if you have not already, hit that subscribe button so you can stay up to date on all things Be a Nurse They Said. Don't forget to also like this video, comment your thoughts. Also be sure to check out my TikTok and my Instagram account, Be a Nurse They Said, where I post updates on my channel and I post lots of shorts that you can watch. And remember, don't just be a nurse, be amazing like I know you all are, and I'll see you next time.